Imagine living hours away from the closest hospital, being unable to afford the medication you need, or struggling to access care that respects your language, values, and lived experiences. For many across New South Wales, this is a reality. New South Wales Health has indicated that in order to combat these issues of inequity, we need to identify the underlying issues and provide high-quality individual healthcare for all. Our team looked into equity in New South Wales and found that despite various government efforts to bridge the gap, access to care is still dependent on where you live. Statistics show that the most populated 20% receive more than half of all health services, clearly leaving regional and rural communities behind. Langdon Winner reminds us that technologies are never neutral. They shape who benefits and who is left out. New South Wales Health digital systems already gather data, but they don't yet work for everyone. Our challenge was to reimagine these technologies so they can serve the entire community and not just the most connected.
To address this, we propose that in 5 years' time, New South Wales Health will utilise our reimagined technologies to enhance how it gathers and retains community health concerns and information, helping to close equity gaps in care and access. Our team combined our areas of study to create one connected system that identifies and responds to health inequities. We faced difficulty in combining these technologies into one singular app, and instead found that we could address these issues by following a 3-step process. This was 1. Information gathering, 2. Information processing, and 3. Technological application. We developed this process to ensure that we approached our problem both holistically and realistically. This synthesis reflects Langdon Winner's idea that when we design technology, we're really designing social systems. Our project turns isolated tools into a cooperative network that supports equity, transparency, and empowers the community.
Let's begin with how we gather information. Right now, New South Wales Health relies on patient surveys and community engagement to collect and analyse information. However, we believe this is inefficient and often misses the most vulnerable. We propose 2 technologies to change this. Satellite technology uses electromagnetic waves for remote sensing. This can detect environmental stresses, pollution, and poor infrastructure, all of which are early indicators of health risks. We will also launch Health Connect, an open forum social media platform which allows communities to freely report concerns, share updates, and connect with services in real time. In applying these 2 technologies together, we collect both environmental and human data to put together a fuller picture of what communities require. It also increases information gathering efficiency while directly engaging with citizens who are affected.
And this is where AI comes in. We will adapt AI legal assistant software to analyze large health datasets while ensuring privacy and transparency. This system can identify equity gaps, for example, areas prone to diseases with low access to care, and flag them for intervention. We will also repurpose Verifine, a forensic explorer tool, to trace systematic health inequities, which will give us a clearer picture of where and why disparities exist. Finally, we will introduce Gretel Care, an econometrics-based forecasting tool. This will allow us to predict future inequities and help New South Wales Health act before crises occur. These AIs are to work together in an ecosystem, learning from human input and physical data, but combining them brought challenges. Different systems store data in different formats, and AI can easily reflect human bias. To overcome this, we proposed ethical AI governance and ongoing human oversight, especially from researchers, local clinics, and Indigenous health representatives, to ensure the models stay fair, transparent, and grounded in reality.
Now let's talk about technological application. Our solution includes the deployment of a surgical robotic system and automated health assistants, which will be sent to areas lacking medical staff and resources. Guided by AI models, they'll perform routine hospital tasks such as patient monitoring, medicine delivery, and sanitation. By automating repetitive tasks, human staff will be less restricted for more complex care. We believe our reimagined technologies will impact 3 main sectors of society. Organisationally, this allows New South Wales Health to reallocate funding more efficiently, streamline operations, and make evidence-based decisions, not built on assumptions. At career level, this creates new roles from researchers and academics in the health space, as they already analyze health data to identify inequities, to AI ethics specialists and robotics maintenance engineers, as they build a future-ready healthcare workforce. Finally, we believe the greater community will be impacted by our solution. A more equitable health system benefits the entire community, and when health inequities are reduced, population well-being and workforce participation improve as well.
While we believe our solution holistically tackles the issue of healthcare inequities in New South Wales, we understand that there are potential challenges we may face. The biggest issue we face is a lack of transparency and bias in AI, as well as the cost and complexity of satellite and robotics integration. But as Winner argues, the ethical design of technologies determines whether it supports or undermines democracy. That's why we built a 5-year timeline to allow for pilot programs, community consultation, and ethical reviews before the full operation. We also recognize the difficulty of combining technologies from so many different fields, but that's exactly what makes our project so transdisciplinary. By blending our knowledge, we design a technology-driven system for equity's sake. Ultimately, our vision redefines the relationship between technology and NSW health. From reactive to predictive, from centralized to inclusive, and from data collection to data justice. We believe this is an investment in not only advanced technology, but also an investment in the equity, efficiency, and the future of healthcare and